Hello, my name is Megan Marcotte. This presentation, titled Integrating Patient and Family Safety Reporting with Mobile Technology, focuses on the use of existing technology to uncover adverse events in the healthcare system and provide patients and their families with the education they need to promote good health and safe care. A 2012 report found that hospital administration relies heavily on incident reporting systems to capture patient safety events. However, only 14% of these events are actually captured by the system, which means millions of events fail to reach the individuals that need to know about them. Thus, it becomes essential that we look at new and unique ways to increase safety reporting. Why not look at patients and family members to report safety events? After all, they are present 24/7 through the entire delivery of care. They are also in a unique position to see adverse events because they know the patient's complete medical history and have a vested interest in making sure the patient's stay is as safe as possible. The product I am proposing is to take an existing technology, a hospital mobile app, and enhance it to allow patients and their families to report safety events. 79% of hospitals have an app already, which would make adding this technology easier to implement. Patients and their families can report actual or near-miss safety events such as medication errors or near-miss falls. The reporting app could go one step further and provide education based on the type of event they are reporting. For example, if a fall is reported, the app will show information on fall prevention. In 2005, the federal government signed the Patient Safety and Quality Improvement Act. Part of this act outlined confidentiality rules and regulations surrounding patient safety information, along with abiding by HIPAA privacy rules. Thus, with implementation of the app, it is essential that this act is supported, which means that patients and their family members must feel comfortable reporting without fear of reprisal. This technology would be targeted at patients and their family members. 64% of Americans have a smartphone, and 62% of those individuals use their phones to look up health conditions. Therefore, they are already comfortable with using their phones when it comes to healthcare. For those who do not have a smartphone, the hospital units could be stocked with iPads that have the app preloaded. Also, the ability to report could be available on the hospital's website for those who do not feel comfortable reporting during the patient's stay or are not comfortable with mobile technology. Currently, there are no products that provide the ability for patients and their family members to report safety events. There are many hospital mobile apps, but none that have this capacity. All patient safety reporting is submitted by healthcare providers, so this would be a new product leveraged off existing technology. The Agency for Healthcare Research and Quality, AHRQ, understands the value of such a system and has funded the development of a prototype which began work in 2012 but has not been completed yet. Thus, this product would certainly be new to the industry. Cost would be difficult to distinguish as it would be based off how much time would be required by a software engineer to build the app. Also, staff would need to be educated on how to use it so they could support the patients as needed. Indirect costs for their training time would be considered. Ongoing costs would be for the help desk support or software updates to the app. Tangible costs would be for the unit to stock iPads and locking devices to prevent their theft. Implementation from a technological standpoint would be easy with a simple app update, which would add the enhanced patient safety reporting module to the existing app. To get the word out about the enhanced app, the hospital's marketing department could roll out a campaign. Permanent signs could be posted as well in each patient room. The only other implementation needs would be staff education on how to use the app so they could support questions, as well as education on encouraging patients and families to report without fear of punishment or revenge for doing so. Changes in policies and procedures for the organization would focus on how the reporting app is operationalized. Clearer policies surrounding a culture of safety and a non-punitive response to the reports would need to be established. Also, procedures would need to be developed that outline how the data is assimilated from the app and analyzed. Furthermore, an outline of how the safety reports are followed up on and who is responsible for the task would be established. How effective the app is will be measured by the number of events reported. More significantly, it will be important to look at the number of events reported that resulted in change to organizational policy or procedure. Also, patients and their family members can be surveyed on their satisfaction with the app and their perceived value of its effect on promoting safety and quality. This product would be marketed to healthcare organizations. When you consider the cost of an adverse event, the cost of implementing and maintaining the app are minimal. The cost to a hospital for one adverse event can range from $58,000 to $113,000, and these costs do not include malpractice claims. Plus, a serious event will tarnish the organization's reputation in the community, further diminishing business. It is also important to market the patient education portion of the app. Providing safety education supports the mission of healthcare organizations to promote good health. This concludes the presentation. Thank you for your time.